once I have, well, okay, there we go. Once I have the recording, I will share the recording and the slides with our listserv and put it on our website. And then, yeah, so here we go. My name's Katie Himes, and I do media and outreach for community, local, and regional food systems. And I'm based in Fayetteville, Arkansas at the University of Arkansas. And Dr. Leong is our leader. She's at North Carolina Agricultural and Technical State University. It has a very impressive bio. I was looking at it the other day. Should check her out. So we're part of the Extension Foundation, which is a national organization that partners with the cooperative extension system. It helps cooperative extension professionals find innovative ways to generate greater local impact through nationally funded programs made possible by member dollars and cooperative agreements with federal agencies and through partnering on state, regional, and national initiatives. It provides professional development to cooperative extension professionals and offers exclusive services to its members. The foundation is an educational partner with over 50 land-grant universities in the United States, but serves all land-grant universities regardless of membership status. And where's my slide? Oh, whoops, there we go. CLRFS is a national foundation, is an extension foundation national project team. And our project team goal is to put knowledge to action, and we share resources, materials, training opportunities, and we foster peer interactions for extension educators, community-based practitioners, and individuals involved in work related to building sustainable, equitable, and just food systems. We're comprised of over 400 extension professionals, university researchers, and food system practitioners from across the country. Some of our resources that we offer include a Facebook page and our website. We receive WordPress support through Extension Foundation to host our website, and funding for that is supported by the New Technologies for Ag Extension Cooperative Agreement with USDA NEPA. And I'm happy to post, gosh, I need to stop this thing. I'm happy to post research findings or links to projects and programs on our website. Just give me an email and let me know. And then you can find us on Facebook at facebook.com/CLRFS. But our primary resource besides these open forums is our Google group listserv, and you can contact me, email me at kdw@uark.edu to be added to that. Now, before I introduce this quarterly open forum, or before Tim does, we want to share some upcoming opportunities. We're getting ahead of ourselves here. The North American Food Systems Network is offering a free facilitator training and certification program. Agri-Cluster Resilience and Expansion, or ACRE for short, is a professionally facilitated strategic planning process to help groups of farmers, especially those in low value chains, work together and compete more effectively in an increasingly complex world. Food systems and agriculture development professionals, such as extension staff, consultants, and nonprofit staff in the Northeast US are encouraged to apply for this program. By joining this first cohort of trainees, you will help beta test the 3-part coursework and become trained in strategic planning for agricultural clusters. And in addition, NAFSN has the Finding Your Future in Food Systems webinar series starting next week. And this web series is open to the public. You can also find recordings of past NAFSN webinars in the events archive on their webpage. Oh. Okay. And then the Food Systems Distribution Society, Research Society, National Agriculture Marketing Summit is next month. And then Northeast SOG's annual It Takes a Region conference is in November. This was just released today from the License Center. Really, regional is a key to food systems resilience. Final report released by Kathy Ruff and Kate Clancy. I had a spiel about that, but I've lost it. So when we share the slideshow, the link will be there that you can click on to read about it. That just came in right before this meeting, so I apologize for not being prepared for that. And so here we go. Tim, you want to introduce?
Yeah, absolutely. Thank you, Katie. And thank you, everybody, for tuning in here today. We're very excited to have this topic around this forum. Katie and Kathleen were gracious enough to have us consider doing a topic around this area of direct marketing, local food marketing, and health. And we're just seeing a lot of interest showing up in terms of whether it's food access issues or food quality and health and wellness, building those linkages. We see more and more communities that are exploring pharmacy type referral programs with farmers market vouchers. We're going to talk about some CSA types of voucher programs too, and how those connect with wellness, and seeing a really neat opportunity, I think, for us in our extension communities to kind of reach across the aisle a little bit to some of our public health and medicine, nursing, nutrition communities here to talk about the role of food and health. And yeah, I think it's a really important topic, lots of innovative things going on there. And hopefully this sort of seeds some ideas and some other conversations even beyond this topic today. So let me go ahead and introduce Londa Nwadike. And Londa, go ahead and you can, were you able to get your slide set up there? I think Katie was going to run it for us.
Yes, thank you, Katie. Yeah, I know sometimes on the backside when you're organizing these, it's easier just to have one slide set. So I'm happy to let Katie advance for me. So yeah, thanks Tim and Katie and Kathleen, all of you for your introduction, and thanks for organizing this today, and thanks to all of you for coming. Yeah, so actually I won't talk too long about myself, but I did my PhD in like agricultural health and safety. So I'm really interested in that intersection between public health and agriculture. So just like Tim was saying, this is really an area that I'm personally really interested in. So our project that I'm going to talk about today is called Double Up Food Bucks, which is there's a number of Double Up Food Bucks across the U.S., but we're funded by the USDA GUS-NIP. So NIP is Nutrition Incentive Program, and I'll talk more about that. But our program is here in the Heartland, so in Kansas and Missouri. And I do work for both. I got my two shirts on. I both work for both K-State and University of Missouri or I work for both. And so this project really is great for me because it covers both states. So you can advance to the next slide. And it's great to see where all of you are from, by the way. I like to see where everybody's at. So Double Up Food Bucks, it's a, as you can see here, I won't read exactly what it says on the slides, but you know, Double Up Food Bucks is definitely working in urban areas as well as rural areas across Kansas and Missouri. And the program is able to take, so when SNAP recipients or people that are on food assistance, they can have they bring their EBT card to the farmer's market, and then they can buy, you know, $1 worth of produce, or sorry, they buy $1 worth of whatever they want on their EBT card. So whatever is allowed. So like meat and milk and bread and those sort of products are also allowed to be purchased with EBT, with your SNAP benefits. So as long as they spend $1 of that, then we can match another $1 that they can use to spend on fruits and vegetables. So we're able to double their, we're able to double the amount of food that they can buy at a farmer's market with this program. So you can go to the next slide. So this program, and I feel like I just can't say enough good about it, and I really do encourage people to look into this USDA GusNIP funding that we were able to receive, because it does go, there is multiple benefits. Families are able to bring home more healthy food. The farmers at our local farmers markets are able to make more money because, more money is coming into the market. So they're able to bring more money home. And I'll just mention too, this program goes really well with senior farmers market nutrition programs as well. So I'm sure a lot of you in your states have that program also. So it's a nice kind of companion program to that too. When we're encouraging more people to shop at farmers markets, then more dollars can stay in the community, which is always great. Okay, next slide. So our particular collaborative is, truly a number of different agencies working together. And this is, I think, an important message to do this sort of programming. It's always important to have all these partners. So the lead agency of our Double Up Food Buck efforts, they started it back in like 2016, I think it was, is the Mid-America Regional Council, which is based in Kansas City. And then K-State Research and Extension takes care of the Kansas side, MU Extension takes care of the Missouri side, and then an NGO called Cultivate KC works with the Kansas City area farmers markets. We have another NGO that takes care of the ones in West Central Missouri, and then our rival school in terms of basketball and football is in charge of the evaluation. So it really does work, and they're the medical center in Kansas. So it really does work well to partner with all these different partners. Okay, you can go to the next slide. So I kind of mentioned this already, but people can come with their EBT card, their SNAP benefits, and then buy $1 worth of any foods that are eligible for SNAP. And then we're able to match another $1 up to $25 a day that they can use to buy fruits and vegetables. So, and we do want to emphasize that, this program does benefit meat and milk, milk product producers as well, because they can use their SNAP dollars to buy those products, and then the match can go to buy fruits and vegetables. So, okay, next slide, please. Okay, so this is about farm stands and mobile markets. We do also provide the program at farm stands and mobile markets as well. It's a little bit different model, but in any case, just to say that we do it in other settings as well. Okay, next slide. Okay, so this slide has got a lot of words on it now because we've gotten to have quite a longer history, but so Mid-America Regional Council led it back in 2015, and they first reached out to, the local NGO Cultivate KC, and then also with KU Med Center, and then, you can kind of see the chronology here. So then K-State Extension was able to get involved in 2020. And then MU Extension was able to get involved in 2022, I guess it was, or 2021. But the big message here is that when we applied for the GusNIP funding that we did get in 2021, they did require a one-to-one match, a dollar for dollar match. And so thankfully we had Mid-America Regional Council had good relationships with private funders, Blue Cross Blue Shield of Kansas City and other foundations, Kansas Health Foundation, to get that match. We were not able to secure that match for the rest of Missouri, but thankfully the COVID relief grant that came out in 2022 did not require a match. And so then we were able to bring back in the rest of Missouri because a match was not required. So, so that was really a blessing for us to be able to apply without that requirement for a match. You can go to the next slide. And I apologize, I see I didn't format this very well, but you can see that, since June of 2016, we've been able to have, almost 6 million tokens have been distributed. The reason why there's only 4.8 have been redeemed, I didn't go into it, but this program is also done in grocery stores. And a lot of the grocery stores, it goes on like their loyalty cards, and the shoppers might not realize that they have that benefit available. So that's something that we are working on, is to try to increase that redemption rate. At the farmer's market, the redemption rate's a lot higher, but okay, you can go to the next slide. So some survey results. We really have, so we do a lot of evaluation in this program. It's a requirement of the USDA funding, but it's obviously very important for us to show an impact. You can see, of course, like Tim talked about, how food insecurity is linked to poor health, and this really kind of shows our the customers that we are working with on this program. Okay, you can go to the next slide. So we have seen that Double Up Food Bucks, has been able to really benefit the people that are part of this program. They're eating more fruits and vegetables. They are, less likely to be worried that their food is going to run out. So, and you can see the quotes there, that we really are, we do feel like we really are able to make a difference with this program. So next slide, please. And then we also surveyed the vendors. From my perspective, that's super important also, that we're supporting our farmers market vendors, and the vendors have been really positive on the results as well as the managers. I will say that we've learned over the years, it does take a lot of just continued outreach and continued familiarization of the customers as well as the vendors and the managers of the program, and a lot of training on how to do the program and reporting and all that. But we're thankful that we have great staff that help with that. So you can go to the next slide. And I apologize, I kind of forgot to check when I started talking. Oh, good, I'm on my last slide, perfect. So my name is there, as well as my colleague Donna Martin with Mid-America Regional Council. But I will say, again, I just think I'm a food safety person really by training, but I just think this program is great, and how we can really help provide more fruits and vegetables to low income consumers and help support farmers markets at the same time. So encourage you all to apply if you have the opportunity. Thanks.
Thank you, Londa. You just had the Urban Food Symposium there, didn't you?
Yeah, in fact, I realized I sent you the wrong slide set. I saw it said Urban Food System Symposium on there. So yes, we just presented this yesterday, in fact, at our Urban Food System Symposium.
Okay.
So yeah, thanks.
Good. Okay, so next we're going to Teresa, correct? Let me stop sharing. There we go.
Dr. Liang said that she wanted Tim to go next.
Oh, Tim's going next. Okay. Okay. Ready when you are.
All right, pulling it up here. Let's see. All right, how's that? Yeah, so I'm Tim Woods, Extension Professor in the Ag Economics Department, and I wanted to appreciate everybody tuning in to kind of think around this topic a little bit. And I wanted to start out with a little pitch to our National CSA Innovation Network, where a lot of this kind of interesting work around CSA and health connections is taking place. There are a lot of good resources I'll point you to later that are kind of in the background of some of this. But what I wanted to kind of share with you all today was just thinking about this CSA voucher program, and particularly the opportunity for a university to be kind of, we could almost call it like an anchor tenant for a community of employers, and having a CSA as an employee benefit program. And I'll talk a little.
Mr. Tim, can you
Yes.
make the screen, your slides bigger so everybody can see them?
Let's see. So do I not have the right screen share?
You need to have it on like slideshow.
Okay, let's try this again. How's that?
Share again, share. We can't
Oh.
see it at all.
Oops.
Share.
Well, let me try here. Let's see. Get it. You will get this.
While we're waiting for Tim to figure this out, if you all would like to introduce yourself, a lot of times network collaborations occur during the open forum. So several people already introduced themselves. If you'd like to just introduce yourself briefly, and then who you would like to connect with, and then that will be great.
Are you able to see that, Katie or Tiffany?
Yes, but yeah, just go back to your actual PowerPoint. You on a Mac?
No.
That's
No,
a, okay.
just PC.
Go back to your actual PowerPoint.
Okay, well, that's what I had there.
Do you have, oh, we saw it for a second.
Can you see that?
Scroll
Yes.
to your next one. Click your next one. It's a little better. It's not as
Yeah.
big, but that's better.
Okay. Well, hopefully everybody can follow me here on this. Yeah, so just talking about CSA as an employee benefit. It's kind of a interesting innovation that we borrowed from some folks up in Wisconsin with the Fair Share Coalition there to adapt it to a community of folks here in Kentucky. And it's just been a really impactful program and a great connection with our wellness community. The roadmap of what I want to kind of talk about today is this CSA as an employee benefit, and talk about why having a voucher program is important. And then just a couple of comments to close it together about why the university might be really a very well-suited lead employer. And many of you guys are connected with schools around the country that I think could be potentially involved in something like this. I think a good place to start that I think frames a lot of what we're talking about here today is thinking about health and wellness in the background. And we have this international data that tracks per capita healthcare expenditures, which have been just increasing at a crazy rate. And even compared to other developed countries, the United States has been way above the rest of the world in terms of just increasing healthcare costs. And you can see when we got to around the time of the COVID disruption, things edged up even higher, and there's a bigger and bigger gap. So across the country, and even certainly within employers, there are concerns about increasing healthcare and insurance costs. Employees more and more leaning in on, do I have appropriate coverage? And thinking about innovations about wellness in the workplace, and what are the roles for our universities, and especially in our land grant spaces, to be leaders in this whole area. We've seen in Kentucky, we're not a very good performing state in terms of eating well. We have lots of diet health related problems. And we see potentially CSA as one way to combat some of these things as a potential intervention. What employers have done to try to mitigate some of these rising costs is they will put higher deductibles and put a lot of these costs back onto the employees. And as you might expect, those folks that are particularly in a more challenging income situation are more adversely affected. The deductibles have increased way faster than workers' earnings, which has really amplified this concern for the need for these wellness innovations. One of the things that we have seen as our Kentucky Farm Share Coalition, the community of farms managing this program, no big surprise, people are eating more vegetables as they're joining in these CSA programs. And we have a long way to go in terms of moving the needle forward in the state, in Kentucky. And I think, again, an opportunity for our employers to provide some real leadership and innovation around how to do this. The advantages for thinking about a CSA program, you can do this in lots of direct marketing platforms. We've talked about farmers market prescription programs, and there are certainly other good programs. But the nice thing about a CSA is it's weekly. It goes for a season. We have a minimum 22-week participation. And what we've studied is trying to understand a whole range of food lifestyle impacts that come about as a result of people participating on this. And the other benefit of the CSA is that while it might be targeted to a particular employee, it has the benefit of reaching the whole household with good quality, fresh local food. And just finally, especially I think in terms of the university space, getting the student farms involved as well as the local farms brings that kind of local products connection to the marketplace in a really unique, innovative way. This is a picture, one of my favorite ones here, of just showing a whole family stopping by to pick up their CSA and having it be this kind of a family community event. I think one of the really important things with CSA is getting the community part of community supported agriculture figured out and building on that as we think about moving toward a community of wellness. The things that can be done or that are important, as we've looked at these CSA impacts, we see people that have started these CSA programs as participating through these vouchers. So many things. This is just a snapshot, but cooking more at home, eating less processed foods, going to the doctor less, spending less on prescriptions, feeling healthier overall. There's a long battery of really well documented impacts that we've been able to capture here that we take to the benefits office, to the wellness office, and to the employers to say, look at these opportunities that you have to help your employees move the needle in this wellness space. Of course, the advantage, with the high frequency weekly share, these food lifestyle impacts, but we'll show you here in just a little bit, not the least of which is the really powerful impacts in opening up new market opportunities for local farms that are interested in doing CSA. This wellness space and employer space, I think, is a whole very ripe area for building new market opportunities for our local producers. We've created this Kentucky Farm Share Coalition. It's a coalition of 7 partner farms now in the central Kentucky area that are serving these employees. Not really a formal cooperative, but they work very closely together to reach out to new employers and participate in these voucher programs together and give the employees choice in terms of which partner farms they want to work with. Why do we need to think about a voucher program per se? I think one of the things that we've seen is that still a lot of our employees may be interested in local food and may have visited a farmer's market, but they're not always very much aware of what is a CSA or what are the benefits of participating in something like that. A voucher provides a really powerful incentive for folks to move from this kind of mid-level local food type consumer to becoming more of a core local food participant. Very interestingly, in some of the data that we've looked at, people actually, believe it or not, shop at the farmers markets more, visit agritourism operations more after they join a CSA, and they become much more aware of these local food marketing options in restaurants and things like this. So it has a real neat opportunity to provide both initial trial, but also with the voucher. We have a $200 voucher for a full share, $150 voucher for a part share that provides about a third of the cost to get folks to try these things. And we've tracked early on as we had done this program, we were looking at the willingness to recommend with a voucher or to buy with a voucher. Obviously, it really helps to encourage people to participate and much more inclined to recommend. And it's just been something now where as a benefit that is provided there, the employees now start to look for it, and they're anticipating when those calls for new subscription opportunities roll up. The thing that is really neat to me about the role of a university in providing some leadership in this space is that a program can get kind of worked out on a pilot basis and developed in terms of how do we improve this and make it work better and more accessible to employees? How do we promote it? Once it gets worked out there, it's very easy to connect to other partners within a region. And here you can see the list of current employer partners that have stepped in to also participate in this program. And it's not just university spaces, it's employers of all different kinds that have their own wellness programs. Some of them are medical connected, but many of them are employers of all different types that just happen to be in the region that are looking to find ways to move the needle in a positive way, in an innovative way with their program, with their employees. So the last thing to mention here is why a university perhaps as a lead employer. The university, especially in our land grant spaces, one of the things that we have found at the University of Kentucky is having a student farm is a kind of a unique value proposition to add in with the CSA. The student farm is one of the 7 supplier farms, but as the employer base has expanded, the employers outside of the University of Kentucky don't connect with the student farm. That just goes to the UK employees. But those, I want to say we have 3 of our CSA farms now that are graduates of the UK Sustainable Ag Program. The university is also in a great place to provide leadership around wellness programs, being typically a larger employer. And so you have a good base of employees to draw from. Having both research and extension that can help with program design, program evaluation, program promotion, and working with our public health partners and wellness partners. Many of your universities that you're all connected with, I'm sure, have public health and medical research partners, and we found those folks leaning in more, looking for ways to help. We've got connections with regional state hospital and regional wellness leadership, as well as those folks have also continued to look for ways to make that food health connection. So
Hey, Tim,
yes,
I'm sorry I need to interrupt, but we need to move on if we
Yep.
can. We've got a couple,
Yep.
if we wrap up in a couple minutes.
Yep, here we go.
Thanks.
So yeah, this is our list of farms that are participating in this program. A lot of neat programs that they provide across the university to provide education to employees, just kind of learning how to make those connections there. And so just the last thing, just to kind of give you a big picture of the program, how it has gone, is just showing you the shares that have been purchased through this coalition of farms and the total dollar impact. And since it started, now we're up close now to almost $3 million of direct farm impact from new CSA activity. So yeah, just to encourage you, we've got so much good information that's out there. I know Katie's going to share this out, the slideshow. I provided a link in here where we've got a whole page of resources for wellness opportunities and data and other studies that we've done, and other partners in the CSA Innovation Network that are also exploring these things. And we'd certainly be very happy to connect you in with some of these things. So yeah, thanks. Thanks for bearing with me. Sorry, Katie, that did go a
No.
little bit longer than I thought, but
That's okay. I hate interrupting, but.
all good, all good.
Right.
Keep me honest.
Thank you. Thank you. Thank you. Okay, so now we have Theresa Nartea from Virginia State University. It looks like you're muted, Teresa.
Hi, everyone. I just want to thank you so much for taking your time today to just be a part of this event. And I hope that what I have to share will be of benefit to you. What I'm going to discuss today is a little bit about Live for Life Duke University Medical Center. And also I noticed that many of the folks that are on this meeting now, you are from North Carolina. Well, way back, you know, and I guess it was 2004, I used to work at North Carolina State University, and then also then moved over to Csa State University. And during that time, actually, I was charged to work on how do you do a workplace CSA. And so this program is an offset of the first program that was started, and they use the actual guide that was created to set up what is now still at Duke University. So I just want to say that if you are trying to set up any of these types of workplace CSAs, the most important thing would be that you actually are able to document the steps of how you have done it, because no matter what, I have helped on many of these over the years, but no matter what, they're always different. So what you experience in one place will be different in another. And if we can collect the information and know what works, say, in a medical center, and then what works at a computer technology workplace, you know, because they're different customers, how that could inform setting up more of these projects. So let me just tell you a little bit about the Duke Farmers Market. I'm just quickly, and I'm trying to get rid of some of this. Okay, the Duke Farmers Market is an annual market, and it's sponsored by Live for Life, Duke's employee wellness program, and it offers a variety of programs and services such as health assessments, smoking cessation programs, fitness activities to help eligible faculty, staff, and family members to reach health and fitness goals. So under the charge of Live for Life, a part of the human resources at Duke University, they found that a farmer's market or a CSA or a hybrid would be suitable to offer to their employees. So let me go to this. So why was that offered? What is the problem? One of the problems actually is employee retention, because did you know that it costs 6 to 9 months of an employee's salary to replace an employee who leaves? So you're talking about half an employee's salary will go into just hiring a new employee. So they want to have programs at, say, institutions where the employees can be retained. And then also for health reasons, trying to get healthy foods and farm products into their employees, because there can be excessive use of sick leave, and that costs employers an average of $3,900 per employee in a year. So it's a lot when you think about, if you could prevent that, imagine what it means to the company for their bottom line. And then naturally, from the extension side, we're always thinking about, at least in the ag and natural resources, how can we come up with ideas that are doable for the farmers? How can we help them to connect to new markets that they may not have thought of? So that is, that is part of the issue, finding new markets for the farmers. But who really benefits, from setting up, say, a workplace CSA? Well, of course, the human resources benefits, the employer, of course, the small farmers, which we saw in Dr. Woods' presentation, how much money went into the coffers of those farmers. So that is wonderful. And then, of course, the employees, giving them a better quality of life. So that would be why for farm to office, that's important. And then I wanted to discuss with you today the Duke University example, and I'll go into that later. And then I want to go through very briefly the steps that you would take to go ahead to doing this, because the one thing is, and why I brought this up, I could have talked about other ones in Virginia, but this one I'm so happy about, because think about it, almost nearly 20 years later, like it's still happening. So that means that it's on solid ground. So if you're going to look at a model, let's look at one that lasted a long time, and what can you learn from it? Okay, so where is this example? It's the Duke University Medical Center. It's a hybrid, actually. It's a farm market and a CSA model. When I had gotten called in to help, it was to set up the workplace CSA model. But, COVID and lots of things have happened, so they have bridged back to the farm market model, but still those farmers that were participating in CSA had the choice to still, continue in the market. So that is something where we must be flexible with the types of markets or outlets that we have, if we're supporting it from the university end, or if you're at a company. Think about all the different ways that you could offer something to your to your employees, or offer something where it's flexible. So if one thing falls short, another thing can come up. It's just always know that everything is in a state of flux, and we mustn't be set in our ways. So here's where the Duke Farmers Market is, right here, smack dab in the Duke University Hospital, serving the outside community who wants to come in and take a look. There are people who go to the hospital and they're getting care. Maybe they're cancer patients or something, they're not well. Well, they can also partake in the market there at Duke, and all of the employees and all of any community who wants to go as well. And also, one thing that's so very important is that when these types of situations are set up, there has to be a very, very strong web presence. So if an institution is weak on that, if you're a service provider, you'll be providing them templates on what they need to say to get the client, their employees to come to the market. How do you set up and put an advertisement in the calendar? Where might you put it? You might have to, as a service provider, take a look at their email communication, or how they communicate on their website, and then provide guidance there on what you would want to put there to make the employees come out of their cubicles and come to the market. Okay, so you know, they all of this is very simple and clean. And then of course, and as you can see, what's so very interesting is how the human resources has integrated the market and the farmers, almost embrace them within their website. So I wanted you to kind of understand how important that is. And if you were, I have this as a screenshot, but I will put in the chat box after the actual website and my link to like the how-to guide and everything. But each of these little links will go to the information available about the farm. So, and then they also, not only that, these links go down. So you click on any one of them and there would be a brief information that is suited for the employees. So, you know, some employees, like busy doctors or whatever, they don't want a lot of information. They want just enough to get them out, you know, get them out to the market and to go buy from these producers. And then also they have another one with the mobile market, and then it has all the directions on setting up the mobile market. And a lot of this in the past, when I had helped on this in the beginning, and they have run through, and if you look on the bottom of the pages for the farmers market and the CSA, they have the actual person that you would contact if you wanted to, like, you know more about these programs and how they set it up at this company or this group. This is so very important as well, that you can contact somebody who's organizing the programs at the different institutions. So that is what that example was, and you will be able to look at that later if that intrigues you. And also you can always contact me and I can give you more information. But let me just go through briefly the steps to sustainability, the steps that make a program like this stay through the years and be flexible and meet the needs of their employees and the farms. One, you must identify a top decision maker at that institution, be it a hospital or be it, a company, be it a university. Who makes the decisions? You must find that out. Then two, you make a pitch to that top decision maker, and you have like a whole, a script. You go in there, they've agreed to meet with you, and then you bring a farmer that's going to be participating, and you have a local food gift basket you hand to them, and then you say, this could be at your company, and then you make that pitch and let them decide if they want to have this program at their company. And then step three is that top decision maker will assign the project to someone in the company who is responsible. You must have someone who is responsible to carry it out, and they will execute the plan. And then you provide as an extension support. We would be then providing the technical support to the assigned designee, whoever the top decision maker or boss executed to do that within their job responsibilities. And then you would conduct a survey, and all of this is spelled out in my guide, which is online at the Center for Environmental Farming Systems website, which Dr. Kathleen, I believe she's in charge of that. So that is there, and you can just download it. And if anything's confusing, well, you could ask me too. I'm available to talk to you. And so it talks about the steps. You conduct a survey. That is an employee survey disseminated directly from the HR, but there's a template where you can get the questions and you find out what the employees want Do they want value-added products, or do they want fish, or what do they want? And you're able to rank that and then come back with data to farmers and say, hey, in this area near you is a company that wants you to come and sell there, either through a CSA or through a farmer's market. Are you interested? Guess what? They said they would buy this. This is what they said they would be willing to pay. And then you have the confidence of the farmers and to go out there and know that they will be successful, because the last thing we want to do is bring a farmer to the table and then they don't have any profitability. It's too stressful for them. So anyway, also creating communication templates. So whoever is the designee sending out the communications, there's no uncertainty for them as far as this is how you would frame out the website language. This is how you would frame out a communication email to say, please come out to the farmer's market. The farmers are here. Don't forget about the farmers, blah, blah, blah. So having all those templates ready for them, you want them to know and feel like they can do it. And even though they don't know that how it's going to work out in year one. So you're basically training the designee to be able to do it. And then when said designee might go to another job, they have the guide, they have everything available to hand over to the next assigned designee. And that's how you build sustainability in these programs. You build the company so that they can take it over, and we step back as extension people. So market logistics, having volunteers, and then evaluating in year one where to improve. So those are the steps. The how-to guide, again, is available at the Center for Environmental Farming Systems, and I'll put this in the chat box when I'm done. And it kind of goes through and has actual examples in it, and you can just download that and walk through how it was set up. Now, the thing about it is when we set up this program, the CSA was the impetus. And the other thing was, what's very interesting is that the farmers can be beginning and they can just pick, like, they are only going to bring tomatoes. They're only going to bring eggs. There are some with the full package. There are some that bring nursery plants. And then, and you'll find all that in the booklet. But the thing is that you don't have to have everything. You know, a CSA freaks the farmers out because for some, they want to get into it. But this here is just then becoming a subscription. So you can have someone with one product, cut flowers, and then the employees sign up for all these different farms. They're supporting several farms at one time, maybe bundling ones they like they like eggs, and then, or they just want the whole thing in one boot, whatever. So, you know, flexible, nothing, your imagination is what it can be. So I just wanted to let you know that if this is just a starting point, you'll figure out something even better. And then I guess the last word is what people feel, you know, the customers. So I'll just read some at the Cancer Center. Good food on the inside, good friends to visit weekly, good sense on the outside, to conserve gas for ourselves and provide income for local farmers. This is a win-win situation. This program ensures that each week my family will have a box of locally grown fruits and vegetables, no matter what my schedule is. This is a wonderful opportunity to get to conveniently get fresh produce from a local farmer, and to do so much more regularly than I'd be able to manage on my own. I'd like to thank the organizers for selecting the farms that practice organic and sustainable farming methods. Now, you don't have to do hard and fast, but in the survey to introduce the concept to the employees, that marked very high up that they wanted that. So we at Extension selected farms like that. And anyway, so that is this in a nutshell. I was told to only do 10 slides. So I was trying to be obedient, but if you need more information, that's me. And I want to thank you for your time.
Wow, thank you, Teresa. That was fantastic.
Okay. I'm going to put everything in the little chat box now.
Good. Great, great. Okay. Now, are there any questions for any of our presenters from the audience? There's nothing in the chat box.
So actually, I asked Tim this question directly in the chat, because I was, how do I say, embarrassed to say that I couldn't remember if he said this or not. So I just said it directly to him. But yeah, maybe other people might be interested too, Tim, in your source of funding, like specifically where in USDA you got that initial grant funding. That was what I was curious about.
Yeah. So, I mean, we started out with an FMPP grant to do a very basic proof of concept pilot, where we did some pretty extensive pre-post surveying of employees that participated and those employees that didn't, doing some kind of comparative impacts. But the funding model, we always had this kind of in our mind, was that in order for it to be a sustainable venture, the employers were going to have to anticipate paying some kind of a service fee for the coordination facilitation, which they do. And the farms themselves also pay a $20 for a full share, $10 for a part share marketing fee to this Kentucky Farm Share Coalition. And what that does is that helps build a pool of funds that helps the Kentucky Farm Share Coalition staff to continue to recruit more employers and do some of the evaluation. And they maintain a very active and useful website for both the employees and the employers. And so trying to wean it off of just this kind of grant dependence and kind of put it over so where the employers can see the benefit. So, and that hasn't really been that big of a lift for employers to pitch in.
There's
Yeah.
a question in the chat box.
I see that. I'll start with Trevor. Carl's is a little bit more complicated, but we have probably a couple of relatively larger CSA operations that would be the 500 to 600 share operations are a couple of them. The university farm has, I think, 250 shares. And then some of the other farms are smaller than that. As we've been adding more farms as the program's gone on, we continue to try to encourage farms. They don't have to be massive. Once you get a network or a coalition of CSAs working together in a program like this to offer something like this, the marginal cost of adding a few more farms is relatively modest. But we do try to vet farms to make sure that they're ready to bring a good quality product. Yeah, Carl, maybe I'd love to hear your kind of take on it in your interaction from the employer and the admin costs, what that looked like, what sort of costs were you paying? And maybe about the employer even.
Turn on the mic. Are we on?
Yep, we got you.
Oh, hello. Yes. I can speak from experience. We've been doing a CSA a long time. And we're encountering a significant amount of overhead in just interfacing with the customers, in that number one, they're not very well informed about what a CSA is. Number two, their let's say consumption patterns are variable, and they have to reschedule frequently. Number three, it would probably be collections, right? They're different main abilities to pay. Some have no problem writing a big check. Others have to have a payment plan. So that gets complicated. Then you have the bookkeeping of all that in the back end. That's the administrative overhead that I'm referring to. It's considerable.
Yeah, that's a super observation, and you know there are so many different ways one can set up a CSA to employer program. The way we pitch this program here to the employers is that really the main administrative lift from the employer's point of view is they have to promote the program and pre-qualify people that are going to be eligible to have a voucher. But then the employees basically go on to the site of the participating CSA farms, and they just sign up as a regular CSA shareholder. There's nothing else to it except that, you know, the employer may designate a pickup spot. You know, when I talk about the employer paying a service fee to this Kentucky Farm Share Coalition that's facilitating this, the employer pays basically something like a 10% of the total vouchers that are provided. But the research that we've done, just in terms of looking at the dollar impacts on the lower insurance claims, for each dollar that the employer is putting into this program, they're getting over $3 reduction in their insurance cost. And so for many of these employers that are self-insured and are having to look at how do we manage some of these crazy out of control insurance costs, having information like that's helpful.
Got it. Okay. Yeah, we're just participating to actually understand that that, I guess, functional part of the overall marketing effort. It's really like a third party is participating along with the farmer, is what you're
right. That's right. That's right.
Yeah.
It is, you know, a lot of farms, that's kind of the traditional model, is a one farm to one employer workplace CSA program. And that can be done. Some farms do it. You guys are doing it. But we found that if there are ways for farms to kind of work together, even in a small coalition, employers, especially bigger employers, get more comfortable looking at giving their employees options of 2, 3, 4 farms they can choose from.
Absolutely.
Yeah,
absolutely. And that, yeah, variety is a very important motivator for people to participate in any kind of market.
Mm-hmm.
Yeah, having choice.
Yep, super.
There was a question in regards to what is the average size of farms participating. In general, over the years, what I've seen is that the farms, they vary in size. They can be as small as like 1 acre all the way up to a commercial size type of farm. But the key really is that there is a willingness of the farmer to try to do this different type of marketing. And so I think I'm seeing more of the smaller farmers, at least in the projects that I've done over the years, where they're more adaptable, they're more they're more willing to do some of the customer service that's involved with things where you have to collect money from the customer ahead. And then it also boosts them to become a larger operation in time, because they're building their capital through this such initiatives and so on. And then there was another question that from Agent Kelly Liddington, and he said, has anyone experienced a grassroots producer group that is involved in a more organic way on the development side, any co-op? So I have to say at this point, I haven't worked with a co-op to do this, but it's definitely feasible to be done. How about you, Dr. Woods? And then Dr. Nwadike?
Yeah, it's a good question. We're seeing these coalitions of CSAs pulling together in different parts of the country. Like I said, we had drawn liberally from the Fair Share Coalition folks up in Wisconsin that started out at, I can't think of how many farmers, there's 50, 60 farmers plus, but there's a coalition of CSAs in the Portland, Oregon area, the Hudson, Glenwood, Hudson Valley network of CSAs that are working together. And there really is a lot that can be explored, I think, in these kinds of coalition opportunities. And you don't have to be a huge coalition. We've only got, we've grown from up to 7 farms in this little one that we've got here in Kentucky. So it doesn't have to involve a huge network, but like we were saying just a few minutes ago, giving employers some choice and kind of showing it the benefit spreading across multiple folks, I think is a nice benefit to it.
Actually, Dr. Woods, like, remember in the beginning, your slide that had that database sort of CSA you had mentioned, is
The
that
CSA Innovation Network?
yeah, is that like, it's also like a database of examples or something?
Yeah, so it's a national resource, this CSA Innovation Network.
Okay.
That I'll drop that in the chat here
Yeah,
too.
that's where I was going, that you
Yep,
could.
Yep, happy to do that. Yep,
Actually,
super resource.
Londa, there was a question in here from Mr. Frost for you. Has there been a resolution to the dollar transaction limitation imposed by SNAP and its incompatibility with lump sum CSA payment in advance? You must know that answer.
It's just ongoing wrangling. I think we'll get there. I think the concerns about food access and trying to be creative and innovative, in our local food spaces, especially. I know there are a lot of people that are lobbying for it, but I can't tell you that it's easily resolved. I will just mention just a little bit of side while it's kind of connecting to the health thing. One of our more innovative CSA partners was this group called St. Elizabeth Healthcare, and they have a voucher program that they use, but it's specifically targeted to people that have been identified as diabetic or pre-diabetic.
Oh.
And so they screen those folks and have enrolled them in the program. This was the first summer this time, but I see healthcare entities like that looking for these kinds of target populations that are at risk for health in some way, and really trying to target a program like this as an intervention that I think has tons of potential in our local food spaces. So we're kind of excited to see those results, and we'll be happy to share those out.
Yeah, in fact, I just Googled, so honestly, my colleagues that I work with are the ones that deal with the day-to-day part of this SNAP and CSA, and I hear them talk about it all the time. And yes, it's very complicated. but so, and I just Googled it, actually, I mean, so I'm just putting in some links that I found. So people are able to deal with it, but you can't technically use, like when I Googled it, the first thing that came up is customers may not use SNAP benefits to pay for a CSA membership fee. So yeah, it's that membership fee is the problem, but so there is, so yeah, you can do it, but you just have to be creative in how you describe it and and list it as an item, whatever. So I know that it's possible, but it's still complicated. I'll just say that. Yeah. Like I even see, I'll just mention since it's quiet, I see here like the government of Massachusetts has a SNAP CSA pilot, for example. I mean, that's just what I found on a quick Google search. So I know that there's a number of different efforts to try to help with that. So yes, we're all working together on that, I think.
Well, I've never really participated in one of these. Do we actually, if we don't have a lot of questions happening, how does that go? Do we just go to 2 o'clock or?
No. We'll wrap it up and let everyone go. I see people are dropping out. So I wanted to say, I want to say thank you three. It's been very, very good. I've enjoyed this very much. Very helpful. And I also wanted to see if anyone, if you have ideas for future topics for open forums, please, you can drop them in the chat box or you can email me at kdw@uark.edu. I'd really like to hear from membership what they would like to know about, or or if you have things that you want to present, let me know and we can build a topic around your research. So I guess if no one has anything else, then we can adjourn, and I will be sending out the slides and the recording as soon as I have everything collected. And we'll send the chat to the people who attended the event. Actually, that won't go out publicly, but for all of you who were here, you'll have access to the chat. So, okay. Well,
Thanks,
thank
everybody.
you. All right.
Thanks for joining.
Yeah, thanks.
Yeah.
Bye.
All right. Bye. Okay. I'm going to end.